What if I told you that in the next 10 minutes, you could feel warmth spreading through your lower abdomen, a subtle pulse returning, a gentle but undeniable fullness building, without a prescription? Not tomorrow, not after weeks, within minutes. And no, this is not psychological, this is not just in your head, this is not a placebo. I want you to imagine something very specific. You drink something simple, warm, slightly sharp on the tongue. Within 3 to 5 minutes, you feel a mild heat in your chest. Then your ears feel warm, your fingers feel more alive, your breathing deepens slightly. And then, without stimulation yet, you notice a quiet heaviness in your pelvic area. That sensation is not magic. That is blood flow. That is nerve activation. That is vascular signaling waking up. Most men think erections are about desire, or testosterone, or mood. They're not. An erection is a hydraulic event. It is circulation under pressure directed by nerve signals. If circulation improves quickly, erections improve quickly. If nitric oxide rises, arteries relax. If arteries relax, blood enters the penile chambers more efficiently. If nerve signaling is amplified, the response becomes stronger and faster. This drink works because it activates all three systems at once: vascular dilation, nitric oxide signaling, and neurovascular stimulation. I'm Dr. Lena. I'm board certified and have spent over a decade working with men struggling with erectile changes, prostate health, metabolic slowdown, and circulation decline. I see men every week who say the same thing: "Doctor, it still works, just not like it used to." And that sentence tells me exactly what's happening. Your body hasn't failed you. Your blood vessels have stiffened. Your nitric oxide production has slowed. Your nerve sensitivity has dulled slightly. That's aging physiology, not dysfunction, not weakness. Now, before I go further, I need to be responsible. If you have severe acid reflux, active stomach ulcers, uncontrolled high blood pressure, are taking nitrate medications, strong blood thinners, or have a history of gout flare-ups, you need to speak with your physician before trying any strong circulatory stimulant. If you're extremely sensitive to spicy or acidic foods, you'll also want to adjust carefully. This isn't dangerous for most healthy men, but context matters. Now, here's what fascinates me. When I explain the mechanism behind this drink, my patients stop thinking of it as a trick. They understand it as physiology. Because when you stimulate nitric oxide production and enhance microcirculation, the body responds fast, within minutes. You feel warmth because vessels dilate. You feel pulse because blood volume increases locally. You feel fullness because vascular chambers are filling more efficiently. So, what are these two ingredients? They're simple. You probably have them in your kitchen. But the power is not in their simplicity. The power is in what they activate inside you. Let me show you why this works. Let's slow this down and really understand what is happening inside your body. Because when men understand the mechanism, they stop chasing gimmicks and start respecting physiology. We begin with lemon. Fresh lemon juice is rich in vitamin C, but I don't want you thinking about this as a vitamin boost. I want you thinking about endothelial protection. The endothelium is the thin inner lining of your blood vessels. It is not just a passive tube. It is an active chemical factory. One of its most important jobs is producing nitric oxide. Nitric oxide is the signal that tells smooth muscle in your arteries to relax. When that smooth muscle relaxes, the artery widens. When it widens, blood flow increases dramatically. Now, here is what happens with age. After about 40 to 45, oxidative stress increases in the bloodstream. This can come from poor sleep, stress, elevated blood sugar, abdominal fat, or simply accumulated metabolic wear and tear. Oxidative molecules break down nitric oxide faster than your body can replenish it. So even if your endothelium produces nitric oxide, it doesn't last long enough to create a strong dilation response. Vitamin C acts as a stabilizer. It reduces oxidative breakdown of nitric oxide. Think of it as protecting the signal long enough for it to do its job. When you drink lemon water, vitamin C enters circulation relatively quickly. Within minutes, it begins reducing oxidative stress in the bloodstream. That means nitric oxide signaling becomes more efficient. This matters tremendously in erectile physiology. Inside the penis are two cylindrical chambers called the corpora cavernosa. These chambers are surrounded by smooth muscle fibers. In a flaccid state, those muscles remain slightly contracted, limiting blood entry. When nitric oxide is released, it triggers a cascade involving cyclic GMP, which relaxes those smooth muscle fibers. The arteries feeding the penis widen. Blood rushes in under pressure. As the chambers expand, they compress the veins that would normally allow blood to exit. That trapping mechanism is what creates firmness. Without sufficient nitric oxide, that relaxation is incomplete. Blood trickles in instead of surging. The erection may begin but not fully develop, or it may develop but fade quickly. Now let's layer in aging again. As men age, endothelial cells become less responsive. They produce less nitric oxide in response to stimulation. That's why erections may require more stimulation than before, or why the response feels delayed. Lemon supports this system by protecting nitric oxide and mildly enhancing endothelial responsiveness. But on its own, that would not explain the noticeable warmth some men feel within minutes. This is where honey enters the equation. Raw honey is not just sugar. It contains trace enzymes, antioxidants, small amounts of amino acids, and natural carbohydrates that trigger a mild insulin response. Now, stay with me here. When insulin rises slightly, it does more than regulate blood sugar. Insulin stimulates nitric oxide synthase in endothelial cells. Nitric oxide synthase is the enzyme responsible for producing nitric oxide. So honey gently nudges the body to produce more nitric oxide, while lemon helps protect the nitric oxide that's produced. That combination matters. But honey also affects the nervous system. Carbohydrates, especially natural ones, increase dopamine signaling in the brain. Dopamine enhances arousal pathways and increases the sensitivity of the reward and motivation circuits. This is subtle. We are not talking about a stimulant effect like caffeine. We are talking about enhanced neural responsiveness. The pelvic floor and genital region are heavily innervated by the pudendal nerve. That nerve carries sensory information to the brain and motor signals back to the penile tissue. When dopamine signaling improves slightly, nerve transmission becomes more efficient. That's why some men describe increased sensitivity or quicker response after consuming natural carbohydrates in moderation. Now connect the pieces. Lemon stabilizes nitric oxide. Honey stimulates nitric oxide production. Honey also enhances neural responsiveness. Improved nitric oxide means arteries relax more efficiently. Improved neural responsiveness means the signal to initiate and maintain erection is stronger. Together, this creates a synergistic effect. And here's something most men don't realize. Erections are primarily a blood flow event, but they are initiated by nerve signaling. Without nerve activation, nitric oxide is not released locally in sufficient amounts, and without adequate nitric oxide, blood flow cannot increase properly. It is a two-system event. Nerves trigger, blood fills, veins trap. If any part of that chain weakens, the result weakens. As men age, three changes typically occur simultaneously.
First, endothelial nitric oxide production decreases. Second, arterial stiffness increases, meaning vessels do not relax as easily. Third, nerve conduction speed slows slightly, especially if blood sugar has been elevated over time. This is why so many men in their 50s say, "I still have desire, but my body doesn't respond the same way." Desire is neurological, erection is vascular. They must work together. When you drink this combination, within minutes you may feel warmth in your chest or ears. That is peripheral vasodilation. Blood vessels throughout your body are relaxing slightly. You may notice your hands feel warmer. That is increased microcirculation. And if intimacy follows, you may notice a faster transition from arousal to firmness. Not because something artificial forced it, but because vascular signaling was supported. And here's an important distinction. This does not override severe vascular disease. It does not replace medical treatment for significant erectile dysfunction caused by advanced arterial blockage. But in men experiencing mild to moderate vascular sluggishness, the kind that comes with early aging, supporting nitric oxide pathways can produce noticeable improvement. This is not mystical. This is chemistry interacting with anatomy. When you understand the system, the solution makes sense. We are not adding hormones. We are not forcing blood vessels open with pharmaceutical strength. We are enhancing a pathway that already exists inside you. And because vascular chemistry responds quickly, the effects can begin quickly. Warmth spreading, subtle fullness, improved responsiveness. Not dramatic, not extreme, but physiologically logical. And when you understand why something works, your confidence increases, and confidence itself enhances neural signaling, which brings us full circle. The body is not failing you, it is asking for support, and when support aligns with biology, results often follow.
Now let's make this practical, because even something simple can be done incorrectly, and when it comes to vascular health, subtle details matter. To prepare this drink properly, you'll use 1 tablespoon of freshly squeezed lemon juice and 1 tablespoon of raw, unfiltered honey, not lemon concentrate from a plastic bottle that has been sitting on a shelf for months. Fresh juice matters because vitamin C degrades over time and exposure to light. Add both ingredients to 1 cup of warm water. Not boiling water, not ice cold. Warm, roughly body temperature or slightly above. If the water is too hot, it can degrade some of the enzymatic components in raw honey. If it's too cold, absorption slows and you may not feel the same gentle circulatory response. Stir slowly until the honey fully dissolves. Drink it gradually, not in one gulp. Let it move through your system. Timing is important. Your digestive system competes for blood flow. If you drink this immediately after a heavy meal, especially one high in fat, much of your circulation will already be directed toward digestion. That can blunt the vascular effect. Ideally, consume it on an empty stomach, or at least 2 hours after eating. If you're planning intimacy, about 20 to 30 minutes beforehand is reasonable. That allows time for mild nitric oxide enhancement and metabolic signaling to begin. Now, I need to emphasize something very clearly. More is not better. This is where men often sabotage simple solutions. Doubling the lemon will not double nitric oxide. It may irritate your stomach lining. Too much acid can trigger reflux, especially if you already have sensitivity. Doubling the honey will not improve erections further. It may spike blood sugar unnecessarily, particularly if you have insulin resistance or pre-diabetes. Physiology works within ranges. Support the system gently. Do not overwhelm it. If you feel facial flushing, mild warmth, or even a slight headache, that tells you your vessels responded strongly. In that case, reduce the amount next time.
Your goal is subtle enhancement, not intensity. If you have diabetes, you must account for the carbohydrate content of honey. 1 tablespoon contains roughly 15 to 17 grams of carbohydrates. That needs to fit within your daily plan. If you have chronic acid reflux, gastritis, or a history of ulcers, dilute the lemon further or speak with your physician before using it regularly. And if you take nitrate medications for heart disease or medications specifically prescribed for erectile dysfunction, combining multiple nitric oxide enhancers should always be discussed with your doctor. Safety comes first. Now let's talk about frequency. For most men, occasional use before intimacy is sufficient. Some choose to use it once daily as part of a morning routine. That's generally safe for healthy individuals. But remember, this is not a dependency tool. It is not something your body must rely on. It is a support mechanism. The real conversation we need to have goes beyond this drink. Erectile health is not isolated to the pelvis. It is a reflection of systemic vascular health. The arteries that supply your penis are smaller than the arteries that supply your heart. Because they are smaller, they show signs of reduced circulation earlier. In many cases, mild erectile changes are an early warning sign of broader vascular strain. That is not meant to alarm you. It is meant to empower you. When erections soften, your body may be whispering, "Improve circulation," and circulation is influenced by daily habits. Movement keeps endothelial cells active. Hydration supports blood volume. Sleep regulates testosterone and nitric oxide production. Blood sugar control preserves nerve sensitivity. Chronic stress constricts vessels and elevates cortisol, which interferes with sexual signaling. Everything is connected. Metabolism affects hormones. Hormones affect nitric oxide. Nitric oxide affects blood flow. Blood flow affects erection quality. There is no single magic lever, but there are many small ones you can adjust. This drink is one of those small levers. It enhances a pathway. It reminds the vascular system how to respond. It can create that subtle warmth that reassures you your body is still capable. But long-term strength comes from consistency in the basics. Walking daily, maintaining waist circumference, managing blood pressure, supporting testosterone naturally through sleep and resistance training, reducing excess alcohol. These are not dramatic interventions, they are foundational ones. And I want to address something deeper here. Many men interpret erectile change as personal failure, as a loss of masculinity, as a signal that something essential is gone. That belief alone increases performance anxiety. Anxiety activates the sympathetic nervous system, the fight or flight system. When that system is dominant, blood vessels constrict. The very system required for erection becomes inhibited. Calm confidence activates the parasympathetic nervous system, the rest and respond system. That state allows nitric oxide release and vascular expansion. So when you understand what is happening inside your body, fear decreases. When fear decreases, performance improves. Knowledge changes physiology. Aging is not the enemy. Neglect is. Ignoring blood pressure is neglect. Ignoring rising blood sugar is neglect. Ignoring physical inactivity is neglect. But aging itself, aging simply requires smarter support. Your body is not broken at 50 or 60. It is adaptive. It responds to what you give it. If you support circulation, circulation improves. If you protect nerve health, sensitivity improves. If you reduce inflammation, endothelial function improves. The male body remains responsive far longer than most men are led to believe. Sometimes it simply needs better input. And that is the perspective I want you to leave with. Not that you've discovered a secret drink, but that you understand the system. When you understand the system, you stop chasing extremes. You start supporting physiology. In our next discussion, I want to talk about morning erections, why they matter more than most men realize, and what it means when they quietly disappear over time. Because those early morning changes are often the first measurable sign of vascular shift. Until then, focus on your circulation, support it gently, respect it consistently, and remember, your body is not working against you, it is responding to how it's treated. I'll see you in the next video.